Did you know that every single month, your body builds an entirely new organ-like tissue just to shed it days later? Most women go through this their entire lives without ever truly understanding the science behind it. Today, I'm going to change that. Every single month, your body does something that most doctors never explain in detail. It's a complex, beautiful, and deeply personal cycle that affects your energy, your mood, and your overall health. Whether you're looking to understand your own body better, or you're just curious about the incredible biology of the human reproductive system, you are in the right place. I promise that by the end of this video, you will see your cycle in a whole new light. We're going to look inside the body with 3D animation to see exactly what happens to your uterus, your ovaries, and your hormones every single day of the month. No more mystery, just real science. Because when you understand how your body works, you can finally start working with it instead of against it. Let's dive into the fascinating world of the menstrual cycle. My name is Dr. Chloe Anderson, and on this channel I explain exactly what is happening inside your body, using science, 3D animation, and simple language that anyone can understand. In today's video, you will discover Number 1. How the uterine lining actually sheds. Number 2. The secret journey of the developing follicle. Number 3. The chemical magic of ovulation. Number 4. Why your hormones shift during the luteal phase. And number 5, how to use this knowledge to optimize your health. Let's get started. We begin at day 1. This is the first day of your period. While it might feel like an ending in medical terms, it's actually the beginning of a brand new cycle. Your period occurs because the lining of your uterus, known as the endometrium, is shedding. This lining was built up during the previous cycle to support a potential pregnancy. When pregnancy doesn't happen, hormone levels drop, signaling the uterus to let go of this tissue. It's a sophisticated process of renewal that your body performs with precision. In this 3D view, you can see the uterine cavity. The lining is thick and rich with blood vessels. As the hormone progesterone drops, these vessels constrict and the tissue begins to separate. It's not just blood, it's a mixture of tissue, mucus, and secretions. Your uterus actually contracts to help this process along, which is what causes those familiar cramps. These contractions are your body's way of ensuring the lining is cleared efficiently. Even during this phase, your brain is already preparing for what comes next. Your hormones are starting to shift. While you are bleeding, your pituitary gland is already sending out a messenger called follicle stimulating hormone, or FSH. This is the signal for the ovaries to wake up. Your body is incredibly efficient. It doesn't wait for one phase to end before starting the next. It's a continuous, overlapping flow of signals and responses. But how does it pick the right egg? This brings us to the follicular phase. This phase starts on day 1 and lasts until ovulation. This is where the magic of selection and growth happens deep within your ovaries. Inside your ovaries, there are thousands of tiny sacs called follicles. Each one contains an immature egg. FSH stimulates several of these follicles to start growing at the same time. As these follicles grow, they begin to produce estrogen. Estrogen is the hormone that makes you feel more energetic, social, and sharp during this part of your month. It's the rising tide of the cycle. Look at these follicles. They are competing for dominance. Eventually, one follicle becomes the leader, the dominant follicle. It outpaces the others and becomes the primary source of estrogen. The other follicles stop growing and are reabsorbed by the body. This dominant follicle is now preparing to release its egg. Meanwhile, that estrogen is doing something else very important. Estrogen travels to the uterus and tells the lining to start rebuilding. After the shedding of your period, the lining needs to get thick and lush again. This is the proliferative phase of the uterus. By the time the dominant follicle is ready, the uterine lining is perfectly prepared. It's a masterclass in synchronization. But here's what most doctors never tell their patients about this timing. The length of your cycle is mostly determined by how long this follicular phase lasts. If you have a late period, it's usually because your body took a little longer to pick a dominant follicle. Stress, illness, or even travel can delay this selection process. Your body is smart. If it's under stress, it might wait for a better time to ovulate. It's a built-in safety mechanism. Stay with me. Now, here's where it gets even more fascinating, because what I'm about to show you next, most women go their entire lives never truly understanding. Let's talk about the surge. Ovulation is the climax of the cycle. When estrogen levels reach a certain point, they trigger a massive release of luteinizing hormone, or LH, from your brain. This is the LH surge. This surge is like the starting gun of a race. Within 24 to 36 hours of the surge, the dominant follicle ruptures and the egg is released. This is the only time in the month you can conceive. The LH surge is a powerful chemical signal. In the ovary, the follicle wall becomes thin and weak. This is a highly controlled inflammatory response that allows the egg to escape. The egg is tiny, smaller than a grain of sand, but it carries all the genetic information needed for life. It's swept up by the fallopian tube, where it will wait for about 12 to 24 hours. Most people think ovulation happens on day 14 for everyone, but that's a myth. It can happen much earlier or much later. Knowing your specific ovulation day is the key to understanding your fertility. There are signs you can look for: changes in your cervical mucus, a slight rise in body temperature, or even a mild ache on one side of your abdomen. Your body is giving you clues every single day. Once the egg is released, the follicle that held it doesn't just disappear. It transforms into something completely different, a temporary organ. This leads us to the most misunderstood phase of all. After ovulation, the empty follicle becomes the corpus luteum, which means yellow body in Latin. This tiny structure is now responsible for producing progesterone. Progesterone is the progestation hormone. Its job is to keep the uterine lining stable and thick, preparing it for an embryo to implant. It also raises your body temperature and can affect your mood. The corpus luteum is incredible. It grows rapidly and starts pumping out progesterone. This hormone tells the uterus to stop growing and start secreting nutrients. This is the secretory phase. Most people believe that PMS is just a normal part of being a woman, but the truth is actually that severe symptoms are often a sign of a hormonal imbalance between estrogen and progesterone. If the egg isn't fertilized, the corpus luteum has a limited lifespan, usually about 10 to 14 days. As it begins to break down, progesterone levels crash. This is the final signal. That drop in progesterone is what triggers your period. The blood vessels in the lining constrict, the tissue loses its support, and the cycle begins all over again. It's a perfect closed loop. But how do you take all of this science and use it to feel better every day? I've put together 5 practical tips that every woman should know to master her cycle. Let's look at them now. Knowledge is power, but action is where the change happens. Here are 5 things you can start doing today to understand and optimize your menstrual health. Number 1, track your cycle. Don't just track the start date. Track your energy, your skin, and your mood. You'll start to see patterns that help you plan your life more effectively. Number 2, monitor your energy levels. Use the high estrogen follicular phase for big projects and the high progesterone luteal phase for rest and reflection. Work with your biology. Number 3, note any significant flow changes. Your period is a vital sign. If your flow becomes much heavier or lighter than usual, it's your body telling you to check in with a doctor. Number 4, stay hydrated and eat for your phase. Your body needs different nutrients at different times. Increasing magnesium and healthy fats during your luteal phase can help reduce PMS. Number 5, listen to your body's signals. Pain isn't just part of the deal. If you're struggling, reach out for professional help. You deserve to feel good in your body. Now you know exactly how the menstrual cycle works from the inside out. The human body is truly incredible, and your cycle is a testament to the sophisticated systems that keep you healthy. If this video helped you understand something you never understood before, please hit that subscribe button right now. It helps me create more content just like this for you. My name is Dr. Chloe Anderson, and every single week I explain exactly what is happening inside your body, using 3D animation and real science that finally makes sense. Drop your biggest question about the menstrual cycle in the comments below. I read every single comment, and I want to hear from you. What should we cover next? Thank you for watching, for learning, and for taking care of yourself. I will see you in the next video. Have a wonderful and healthy day.